Okay, we'll start in 1 minute. How are we doing with the quorum, Roz?
Looks like you've got only 1, 2, 3 folk on board right now.
Okay, so the 3 I see are the 3.
Yes, ma'am.
We'll give them just a couple of moments. We can start, I suppose, but we just won't be able to have any official votes. Hey, Josh.
Hey, good evening.
Hey, Dr. Braithwaite.
Hello, how are you all?
Good. Love your hair.
Oh, thanks.
Okay, so it is 5:01. I think we're going to go ahead and start. I'm sure the others will be joining us shortly. I'd like to call to order the regular board meeting of the Durham County Board of Health. This day, I don't know what day it is, December 9th, 2021. Okay, are there any additions or changes to the agenda?
Madam Chair, we have one addition to the agenda under new business. We have one additional amendment for your consideration.
Okay, so that'll be 3. Any other adjustments? If not, I'll entertain a motion to approve the agenda.
Motion. Approved or second?
Okay, it's been moved and seconded that the agenda be approved. Are there any opposed? All right, hearing none, the motion carries. You received the minutes in your mailing?
Chair Jackson, we need
Yes.
to do a roll call. We need to do the roll call.
Oh, I'm sorry. Yes, roll call.
Chair Jackson,
Here.
Dr. Miller, Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes,
Dr. Ray,
Yes.
Mr. Brown,
Yes.
and Commissioner Alon.
yes.
Thank you.
Okay, great. Thank you. Okay, now we'll need to approve the minutes from the previous meetings. So hopefully you've had a chance to review those. Are there any adjustments to the minutes? So we need a motion to approve our minutes from our October meeting.
Motion to approve the minutes. Second.
Okay, it's been moved and second that the October minutes be approved. Any opposition? All right, hearing none, the motion carries. Any public comments?
Do we have to do the roll call?
Oh, I'm sorry, the roll call vote. Where did Roz go? Roz. Did we lose her?
Okay, can you guys hear me now?
Yeah, we can hear you now.
All right. Chair Jackson,
Yes.
Dr. Miller, Dr. McDougall, Mr. Curtis,
Yes.
Dr. Brightway,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
and Commissioner Alam.
Yes.
Okay, thank you. Now, any public comments? Any staff
ma'am.
program? Okay. Any staff or program recognitions, Mr. Jenkins?
Yes, ma'am. And again, I say good evening to the greatest board in all the land. It is a pleasure for me to introduce two new members of our leadership team. First of which you've heard me talk about for several months now. He began on November the 1st. And to my knowledge, he is the first full-time medical director that we have had probably in modern times. I've had a few people who've been here for a while, 25, 30 years, say they've not had a medical director to be full-time. So at this time, I'd love to introduce Dr. Jeff Jenkins and allow him to say a few words to this great board.
All right, great.
Thanks,
Yeah, I was
Rod,
able-
for the introduction. Yeah, I'm super excited to be here in Durham and, be in this role. And, it's, I think, a really interesting time, with COVID, and hopefully we're, starting to turn the corner there. And I think there's a lot of, new opportunities on the horizon. And I think, having someone in this role full time, I think there's a lot of opportunity. So really excited to be here.
Great. Well, we are glad to have you, Dr. Jenks. And is there anywhere, are you in a place where you could show your face? If just for a second? There you go. Great. Yeah, I was fortunate enough to meet you a couple of weeks ago when I was down there. So we are so excited to have you. So excited. So welcome.
Thank you so much.
He has certainly hit the ground running, and we are most fortunate to have Dr. Jenks with us. The next person I'd like to introduce is no stranger to Durham Public Health, for she's been here for quite some time, working in a lab as a lab supervisor. But she most recently received a promotion. So now she is our Allied Health Division Director. Mrs. Lindsay Castor is in place, and she is in charge of our laboratory operations, and she's also over our pharmacy services. So we'll allow Lindsay to say a few words. She's a tad bit bashful, so I promised that she was going to say a one-liner. Did we lose her? I think we may have lost her.
Oh, wow.
All right. Anyway, we'll come back to her if she shows up.
If she comes back. Okay.
The last thing I'd like to say is I'd like to pass it to Ms. Marissa Mortarboy for an announcement as it relates to our partnership with Duke and our Healthy Durham Coalition. Marissa, the floor is yours.
Yeah, thank you, Rod. Good evening, everyone. I'm excited to announce that with our partnership with Duke Health, we are awarded a $100,000 grant from the Duke Endowment. And so this is 1 year of funding. Yes, and so just to give just a high level overview. And so the focus is physical activity and nutrition, but we're going to leverage that. We plan to leverage that funding to move the partnership to to becoming an anti-racist coalition and center community voices. And we will also become part of an existing cohort with communities in North and South Carolina. So we're really looking forward to getting started with this in January. Thank you.
Great. Great. Yes, let your light so shine and people will give you money. Congratulations.
I've heard you say that many times. Thank you so much, Marissa. We appreciate that announcement. Madam Chair, that's all I have.
Okay, thank you. Okay, so next we're going to hear from our guest, Mr. Parks. Rod, I don't know if you want to do a brief introduction or have him introduce himself to us.
I don't have a problem introducing this good man. I hope he doesn't mind me doing it.
Oh, no.
Jerry Parks is former health director, longtime health director, and no stranger to public health in North Carolina. He has been there, done it, and seen it, and probably helped to create a lot of the great systems that we have. Most health directors see him as a sage, for he is filled with wisdom. And as anyone can attest, when you retire and you walk away, it's easy to just get out of it, spend your money that you've earned. But Jerry is still heavily involved in public health, as evidenced by him being here. He does these presentations maybe 4 or 5 a year, and he's still heavily involved in a lot of the different boards that we have in public health. I counted the privilege to be able to know him, and when I came on board in public health, he and my health director were very, very good friends, and still good friends to this very day. And I was able to just kind of slide into that relationship. Had the pleasure of knowing that he is a family man, married to the same woman for many, many years, and has some beautiful grandkids and children. I could go on, but again, he is of age and he can talk for himself. So to this great board, I introduce Mr. Jerry Parks.
All right. Thank you. Thank you. Welcome, Mr.
Thank you,
Parks.
Rod. Thank you for that introduction. I guess you old coaches and co-workers call you Daddy Parks, but I in hearing that. Thank you. For having me. But
Mr.
more
Parks, so
importantly, thank you for what you do for Durham County, and not only for Durham County, but for the state of North Carolina, because through the work you do, and Rod's predecessor, we have a technical problem. Are you good?
yes. No, you keep going in
Okay.
and out.
Well, I am in northeastern North Carolina. So it could be that we'll have a technical problem. I hope we don't.
It's pretty good
I'm
now.
thanking
Okay.
you certainly for the work that you guys do, not only for Durham County, but for the state of North Carolina. Rod's work and his predecessor, Gail, you've always been looked to as a model in public health. And so not only are you serving Durham County community, but you're serving North Carolina. Tonight represents a number of first-time events for me. This is certainly the first time in 2 years due to the COVID pandemic that I have made a presentation. It will be the first time that I have done a presentation on Zoom, and frankly, be the first time I have attended a public health event with blue jeans. I did wear shorts through Hurricane Isabel, because if any of you have ever been through a hurricane, you know how hot and humid it gets. And then with lack of electricity, it's pretty tough. Now I have a challenge tonight. I'm sure there's some that are new to public health. I'm sure there's some that are veterans to public health. So I'm gonna try to make the presentation informative for the new people, and also at least engaging for the veterans of public health. Some ground rules. My daddy was a fire chief. I may or may not use a fire reference. If I do, that's my background. But his number one rule was, because he did a lot of education, his number one rule was the mind consumes what the rear end endures. So that means that brevity is important. I find that the high level discussions are more better received, and brevity is important, because you got a meeting after me. I will try to hit the high points. The other, if you really need to get into the weeds, I'm happy to do that through questions, but more importantly, your director, Director Jenkins, would lead you through some of those conversations. Rod, who's in charge of the slides?
Mr. Parks, this is Rosalind. How are you? Wanted to
I'm
see
fine,
if,
Rod.
good. I can make you the host and you can do them
I'll
yourself.
be happy to tell you to advance the slides if you're
Okay.
okay with
All right.
that.
Okay,
So I'm ready to start if you want to start with the first slide.
okay.
Actually, we probably have already had a good enough introduction. Now, I'm not looking at the slides, so I'm assuming you're on.
Is that the one?
There we go.
Good. All right. This is your agenda for the night. Now, obviously, we're here to talk about your roles and responsibilities for governing boards. The next slide, the agenda, just move through that because you can refer back to that at any time. And again, to keep us moving, I'll tell you when how to advance these slides. Let's move on through to next couple slides. All right, right here. We have probably 3 learning objectives tonight that are important. One, we want to talk about just what is this thing we call public health and how do we carry out our roles and responsibilities. In so doing, we're going to take a look at identifying or discussing briefly some of the laws, rules, and regulations, both those that we enforce and those that guide us in our daily activities. And we'll talk not in depth, but certainly about your roles and responsibilities. Keep in mind, I'm going to move through this presentation fairly quickly. Try to do it about, most boards like it to be about 30 to 40 minutes. Keep in mind, this presentation was developed by a team of graduate students. And these students probably got an A+ because they have everything you can quite imagine about public health in here. However, we don't need all of those slides. We don't need that in-depth, deep dive into public health. So I'm going to advance. There's one entire section we're going to move through, but I'm going to advance through some of the slides fairly quickly. The next one, please. Other way. Okay, let's move to what is public health. Okay. Next one. We're back to the beginning.
Mr. Parks, could you hold on
Yes.
for 1 second, please?
Sure.
My IT person is in here.
Not a problem. Okay, we're getting there. Keep advancing.
Let's do it. Okay, Mr. Parks, I apologize for that. Okay.
Oh gosh, man.
You just tell me what to do because right now she's got my screen tore up. All right. So which one do you need to be on? Slide number 1.
The slide is entitled "What is Public Health?" It's about the all right, right here.
Okay.
All right, now I promise you, my goal is to read you one slide. I've been through many of these presentations. No one likes to be read to. If we were to do that, we'd just send you the slides and let you read them yourself. But I do think this is important. This definition of public health is the only thing that I will read to you verbatim. Public health is organized community efforts aimed at the prevention of disease and promotion of health. It links many disciplines and rests upon the scientific core of epidemiology. That slide encompasses what we want to do tonight. The three major comments I want you to dwell on are community, organized community efforts, prevention of disease, promotion of health. Okay, let's move to the next slide. Before we get here, I think we might have missed a slide in our technical maneuvering there, but let me say this. There are other ways to organize a public health agency. You are an individual county health department with an individual county board working under the county commissioners. Just so you know, you can organize as a district health department, meaning if you wanted to go in with Wake County and form a district, you could do that. If you wanted to consolidate public health with social services and have a consolidated services board, you could do that. But for tonight's purposes, you are an individual county health department, and which I think is great. But I do want to mention that there are other ways to organize, and we did miss that slide. Now, we have done some good things in public health, and a lot of people may or may not even realize it, but the one that pops out at you is vaccinations. Obviously, I am old enough. I've had every childhood vaccination, and I've had pneumonia, shingles, and I get my flu shot every year. So I've had all my vaccinations, and that is an accomplishment of public health. Then you can just look around this slide if you like. One I would like to point out that people don't always attribute to public health is motor vehicle safety. How many lives have we saved? How many injuries have we saved by identifying that seat belts would help us, and also getting the legislation passed for that? You know, the interesting thing about public health, if you know Director Jenkins, I'm sure has heard the story of Dr. Snow and the well epidemic in his community where everybody's getting cholera, and he found that, hey, everybody drinks from the well from one end of town, gets sick. Everybody drinks from the well the other end of town doesn't. So what did he do? As a public health initiative, he removed the handle from the pump. Problem solved. No one drank that water. No one became ill. So that he's deemed basically the father of public health for recognizing that we can take actions that prevent misery, suffering, and death. So keep in mind, I guess what we do in public health, if you want to really be simple about it, we remove pump handles. We remove obstacles. So we have had some accomplishments. Let's move to the next slide. There are a couple more things that public health has done. Certainly, we've made great strides in cancer prevention, childhood lead poisoning. We have very good programming to identify childhood lead issues and remediation. Public health preparedness and response could be an entire session on its own. And the COVID pandemic is a very good example. This is not a COVID presentation, but certainly that is a very good example of public health preparedness. And of course, we were very prepared largely because of 9/11. After 9/11, public health had an infusion of funding, had an infusion of training, and a lot of that knowledge, training, and resources were utilized in gearing up for and addressing the pandemic of COVID. Okay, let's move to the next slide. Let's we certainly have, if I mention the accomplishments, we certainly ought to mention that and acknowledge that we continue to have challenges. We certainly responded to an emergency and continue to respond to an emerging infection. Our environmental health department works every day diligently to make sure our food is safe when we eat at a restaurant, our meat markets are safe, our septic tanks, our water and wastewater are safely handled, but we still have those challenges. We also have many health disparities that we need to work on, and the landscape of public health or health of your community is changing so rapidly, it's very difficult to keep up with. So that leads us to the next slide. Let's move on. No, that's just a summary. And okay, Section 2, move to the next slide. We're going to talk a little bit about big picture public health things, how your health department operates, how public health operates, and then certainly how the board fits into that. Let's move forward. We don't need that slide. Move through that. All right. Core functions of public health. How does Director Jenkins and his staff and you as a board address public health in the community? Well, I'm old enough. Used to it was assess, address, assure. Now they now say assess, policy development, and assurance. But I like assess, address, assure because that rolls off your tongue like stop, drop, and roll, fire reference, or reduce, reuse, recycle. But for tonight, we will call it assessment, policy development, and assurance. Next slide. Now, how do we assess our community? I am a very firm believer that Director Jenkins, in conjunction with you as board members, in conjunction with his staff, have their finger on the pulse of your community in Durham County. I don't think any of you need a formalized process in order to know what the health issues and needs are in your county. However, the state does have a formalized process that has served us well for many years, and that's called the Community Health Assessment. So every 4 years, sometimes 3 if you work in conjunction with a nonprofit hospital, but every 3 to 4 years, they will go through a deep dive, very detailed process of trying to figure out. They use focus groups and those kinds of things in order, and sometimes house-to-house surveys in order to determine what the community needs are. And not only what the community needs are, but what the community perceives as a need. Sometimes that may be different than what we perceive as the needs. So we do this community health assessment to assess our community on a regular cycle. And then on the off years, we kind of do a catch up, which is another just little annual report that supports this 3 to 4 year process. So we do assess our community informally and formally. Let's move to the next slide, please. Now, what do we do with that? Well, certainly we look at the data, we massage the data, but we present that data to the Board of Health. If you're new to the Board of Health, you got that coming. If you're a veteran Board of Health member, you will recall that a director, whether it was Director Jenkins or his predecessor, has brought the community assessment to you. Then the next step is to say, okay, we know what our problems are. We know what the community perceives as problems. Let's put together a strategic plan so that we can try to meet the needs that we've identified in the community. So that is your responsibility in conjunction with Director Jenkins and in conjunction with his staff. Next slide. Now, you've assessed your community and said, hey, we've got a problem here. Let's develop policy, which primarily includes developing programming, seeking funding either from local government, which congratulations on your grant from the Duke Endowment, from Robert Wood Johnson, from Kate B. Reynolds, or some outside sources of funding. Let's find the funding to put together the policy and the programming to meet the needs of our community. Now, what do? Simply put, you support your health department and its director. Give them advice when they need it. Give them advice maybe when they don't think they need it. But that's your role in policy, and you are the board that can make the policy. Director Jenkins can come to you and pitch a policy and or a program, but you are the rubber meets the road. Next slide. Oh, we don't need that. Next slide. Okay, so we've assessed our community. We've come up with programs and policies that we think will be effective in addressing those things that we find in our assessment. Now we're down to assurance. Again, our core functions: assessment, policy development, and finally assurance. Remember that slide I read to you? It said organized community effort. The health department cannot do it all. They don't have the staff. They don't have the expertise. They don't have the funding. But through collaborative efforts in your community, you can find the expertise, you can find the staff, and hopefully you can find the funding. So as a collaborative effort, you assure that the programming is put in place in order to meet the needs of your community and make it a healthier place in which to live. Next slide. Okay, this gets a little busy, and it took me a long time and fairly a few presentations to get through the core functions and essential services. I like to call it, okay, so I'm a board member, I'm new. Mr. Parks in the state of North Carolina says, hey, I've got to assess my community, I've got to develop policy, and I've got to assure that things happen. So how do you do that? What is the roadmap? What is the guide for you to do those things, to be responsible to what it is you have taken on, the task you've taken on? Well, there are 10 essential services. They're codified in North Carolina General Statute. North Carolina legislators decided every health department is responsible to monitor, and you can read these as well as I can, to do these 10 things. And you'll always hear about the 10 essential services if you're in public health very long. There's a whole, you can go to the statute. Let's go to the next slide. It might tell you. No, it doesn't. But we'll talk about the essential services and the statutory citation here again in a minute. What we need to know, we need to assess our community. We're responsible to develop the policy and ensure that programs are put in place. How do we do that? What is our roadmap? What guides us through that? Are the 10 essential services that are codified in law, and we'll look at the codification here in a minute. Next slide. Okay, that's just the opening of section 3. Let's go to the next slide. Okay, here are the citations. These legal authorities guide you in your daily work with public health. They tell you what you must do, and you must do most of these things in order to secure and maintain your funding, quite frankly. The 10 essential services, you'll see General Statute 130A is the public health statute. So all your statutory citations will start with 130A. But we have many legal authorities, and if you really are interested in this, you need to dive into that with Director Jenkins, because you could be here all night talking about these. This is where, grad students put this together, and it's really wonderful, but you cannot possibly have the endurance in one night to go through all these statutory citations. Let's move to the next one. You do need to know that not only are there North Carolina laws, you've got the North Carolina Administrative Code, you've got federal law, and all other kind of agencies that interact with public health. Sometimes some you don't even know. I made a recommendation on bat control of the house one time. I got a call from North Carolina Wildlife telling them that I couldn't do that because bats were endangered species. So sometimes you don't even know all the laws that impact what it is you do. But just know it's not only North Carolina law. There are other codes and laws that come into play. Next slide. Next slide. I don't know why this is the next slide. Okay. State law. What's important to know is that, one, we must do all those 10 things that they tell us to do in our quest to assess and develop policy and assure programming in our community. In addition to that, there are mandated services, thing that North Carolina state law says we must do, we must accomplish. Accreditation is one of the reasons, probably the reason I'm presenting to you tonight, so you can tick that box that your board was trained. Consolidated agreements. I'm not as old as dirt, but I tell people that I was consulted on the color. I've been around a long time. And we used to have consolidated contracts with the state. But guess what? Contract's a contract. So the state didn't want a contract because most of the time, mid-year, they want to either change the level of your funding or the requirements that they had initially. So your consolidated contracts are then renamed to an agreement, which is something that is more easily modified. Just a historical note. And of course, federal law, as we'll talk about in a minute, comes into play more often than you might think. Next slide. State laws, and you see again, and I told you, again and again, you're going to see these 10 essential services that must be either performed or insured by local public health departments. Next slide. Let's talk a little bit about mandated services. There are 12 mandated services that Director Jenkins and his staff and you as a board must provide in Durham County. And you see the statutory citation there. Next slide. Let's talk a little bit about what you must do, what mandated means. Mandated means that you can provide that service for your citizenry, or you can farm it out, ensure that it's the provision of services are there in Durham County. Some counties have been successful in certifying that. One comes to mind is Northampton County does not provide maternal health services for women anymore. They were able to certify that the capacity existed in their county such that they didn't have to deliver those services. So that's a possibility. That rarely happens and it's difficult to prove, but it does happen. So you either got to provide the service, contract it out, or farm it out, or certify that the service is available. Okay, next slide. This gets into the nitty-gritty. On your left, you'll see the things that Director Jenkins and his staff and you as a board must provide. You can't farm it out. You can't certify the provision of services that's already available, and you have to do it. And that's your environmental health programming. Restaurant inspections, septic tank design and inspections, sanitary, the water. Not many people have well water rules anymore, but you have to make sure that water supply is safe, food supply is safe, and waste is properly disposed, is simply put. You are responsible for the communicable disease control, of which I'm sure you have done a wonderful job, with the most recent example being COVID, and you are the keeper of vital records. You sign, or Director Jenkins signs, or is signed on his behalf with a stamp, all death certificates. Examples of things that you do not have to do. Many, if not most, health departments do provide most of these services, but you can insure them. You can hire perhaps pediatric practice to do your child health. It has been done in North Carolina. Maybe an OBGYN practice is able to do your family planning and your maternal health, dental health. Not many people have home health or anymore, but you can, on these services on your right-hand side, you do not have to provide them, but you must assure that these happen. Next slide. All right, this some of this is outdated on this slide, but what you need to get out of this is your presentation tonight as an example. There's certain things you have to do to be accredited. Now, we asked to be accredited. We, as a public health community, wanted to have the credibility that accreditation allows, similar to JCO with hospitals. We wanted standardization in North Carolina. We wanted to be looked at as a state that not only had pride in, but went the next step to require that you do certain things in public health. So that's one of the reasons I'm here tonight. That's a multi-year process, 4 years. I'm privileged to be on that board, so I still am able to see what goes on in North Carolina and be proud of it. Next slide. That's not important anymore. Next slide's outdated, most of that. Consolidated agreements that we just spoke to just briefly, but basically what Director Jenkins does and his staff is they determine what it is they want to accomplish each year in various programs, state-funded programs. They put that in writing, and then they are judged by that to get their funding. He could probably give you some examples, but how many indigent people do you plan to serve in child health? How many people, and that's what that funding is for. If they've got Medicaid, then certainly Medicaid pays for it. But there are a lot of people that do not have the ability to pay. And we have to use those funds and to show how we're going to use those funds to take care of this population. Next slide. All right, federal law. You know, federal law always rears its ugly head. The two that stick out to me on this slide are, first and foremost, HIPAA. There are probably not many people that are either in healthcare and or on the fringes of healthcare that don't know that HIPAA affects healthcare and privacy. So federal law dictates HIPAA right down to screensavers on your screen. It's unbelievable just how in depth that gets. And if you don't follow HIPAA, the penalties are fairly stringent. So we all do probably are HIPAA compliant first and foremost. Language assistance is another one. Certain federal programs, in order to get the federal dollars, which, by the way, a lot of the state dollars flow from the federal government, so they still can tell you how to proceed. So I know people think a lot of the Spanish-speaking community, but believe me, we had a 7-county district health department. We had a large community of fishermen that spoke Vietnamese, the different dialects of different languages. So we had to use a language line, which we paid per minute to translate many times, because even if we had interpreters for Spanish-speaking people, it didn't always interpret because of the different dialects to what we wanted to say. So the two that stand out to me, that federal law really impacts public health and your how you run your business every day, day in and day out, are HIPAA and then language assistance. Next slide. I looked earlier today, I don't think, but 3 of these health directors are still around. I don't know why they keep this picture in there. So let's move through that. We know that you're responsible to appoint the health director. So let's move to the next slide. I think it gets a little more interesting. All right. Your local health director, Rodney Jenkins. You're responsible for hiring him, but he has many, many, many duties. I like to say that he's responsible for the Triple P program. And it used to be a Triple P program, but my Triple P was personnel, politics, and press. Every day of life, Director Jenkins and his staff have to juggle personnel, politics, and staff. Now that's more simply put than this slide. It talks about the administrator, the enforcer, the educator, but and we'll get to that. So let's move to the next slide. The very first one, and I apologize for my passion on this because I am probably, if not the most qualified, at least one of the most qualified people to talk about personnel issues and employing of staff. Director Jenkins is responsible to hire, terminate, and discipline the staff at the Durham County Health Department. Now, I find, maybe not in large health departments, but I can tell you in small health departments, my county, I live in a town of 5,000 people. I have a county population of about somewhere between 14,500 and 15,000 people. Everybody knows everybody. Everybody knows who the county commissioners are. Everybody knows everybody. Believe me, you do not want to get in an employee issue with the staff at the Durham County Health Department. Let your paid person, Mr. Rodney Jenkins, take care of that. And then let me tell you why I bring this up. And again, small counties, it's really a problem, perhaps not in a large county. I have been sued for wrongful termination. It consumed 2 years of my life. Not every day and not all day, any day. Well, maybe some days, yes. Believe me, I've been deposed. I had to answer, I remember it was 22 questions. Didn't sound too bad, does it? Some of those questions were more than a page long with the answers. I had to sit through depositions. Long story short, we won the unemployment hearing. It was thrown out of Superior Court, and the appellate court turned it around almost in record time, supporting my actions. However, I had a lot of Christmas and Thanksgivings and July 4th that I was present, but in the back of my mind was that issue. It just hung on you, hangs on you like an albatross. So why am I making such a big deal out of this? You don't want to get drug into something that you don't need to be into. I just, when I got sued, they sued me and they sued the Board of Health and as a board. And so they didn't have to worry about it. I took care of it. But we have a generation of people that, one, are what I call the up and coming participation trophy people who don't know a lot about being accountable to anything. And they are wizards at anonymity. They know how to get online and say everything and anything about anybody behind a screen name or behind a hashtag. So what I'm saying is, don't go there. If it just will make your life miserable. Enough said about that. And maybe I don't want to step over the line, but again, I had 2 years of my life consumed. My board didn't have to worry about it because they referred everything back to me. And believe me, employees are well protected. You can sleep well at night because these employees have state public personnel law that help them through it, up to and including an administrative judge hearing. And the law is really slanted towards leniency on employees. So if you refer somebody back to the health director and or personnel department at Durham Health Department, you're not doing them a disservice. If they go through the process appropriately, believe me, they will be properly treated and they will get through it. And if they're in the right, they will prevail. If they're not, then they won't. But again, that is responsibility of the local health director. And I did serve 7 small counties. So I served in 7 counties where everybody did know everybody. And they were quick to go to county commissioners and then county commissioners to Board of Health members. So just keep in mind, you just do yourself a favor and just don't go there. Okay, enough said. What else does Director Jenkins do? He prepares the budget. He's the man who's got his finger on the pulse of what's needed. He's the man, as I mentioned before, with your guidance and advice, knows what the community needs. He prepares the budget. And then once he gets the money approved through the county commissioners, then he gets to direct the programs, and then he becomes a communicator with you, the community, and the elected officials. Next slide. That gets into, we know that you're a single county health department, so let's go to the next slide. The enforcer. I don't know if I like that term, but Director Jenkins and his staff do have laws, rules, and regulations that they must enforce. The one that was always a pain for me as a public health director were the septic tank rules. And where it not only just individually, but where it impacted development in our community. And even though you have staff out there enforcing these laws, rules, and regulations, the buck stops with the health director. And then, of course, your communicable disease laws and then immunization requirements, where what comes to mind is children's shots before they go to kindergarten. Director Jenkins and his staff are responsible for abating public health nuisances and imminent public health hazards, and that is more difficult than it looks. Imminent public health hazard was defined, as it was explained by me, is this action is going to cause somebody to die right now, and that's not normally the case. So it's very difficult to use the imminent hazard rules and laws, rules, and regulations. The abatement of public health nuisances is very difficult because then you go through the district court system, and that becomes difficult. An example I like to use is septic tank laws, rules, and regulations. We had a septic tank in January and February that was running sewage all over the ground. But by the time the case got continued to August, when everything dried up, the judge, a good friend of mine, which means he did his job as best he knew how, he said, "Is it working today?" And my environmental health specialist said, "Yes, it's dried up." He said, "Well, come back and see me when it's not working." So it's very, very difficult to abate a public health hazard because others are responsible to weigh in on those laws, rules, and regulations. Very difficult to use imminent public health hazards. So you kind of get the feel as how difficult it is sometimes for Director Jenkins and his staff to get the job done as enforcers. Next slide. When Rod Jenkins walks in a room, he is the face of public health. He should exude public health. So he is your main coordinator, educator, and liaison person. And again, back to organized community efforts. He's that person who works with the hospital, with the local providers, with mental health, with social services, ag extension service. There are lots of people out there that do an education in public health, but he is your main communicator. He is the one in conjunction with you that's going to be out there promoting good things like running and exercise and good eating. And he is going to be collaborating with other jurisdictions. So in addition to being an enforcer, he is also the educator and the face of public health. Next slide. No, most of those people aren't even on the earth now, so let's move forward. All right, big picture. We talked a little bit about what Rod's responsible for, a little bit about laws, rules, and regulations and central services. But at the end of the day, the big picture, this encapsulates your responsibility as a board. And the important thing is, it says you shall have the responsibility to protect and promote the public health. Note the word shall. I learned that early on as an environmental health specialist, the difference between should and shall. It doesn't say you should do it, and it's a really good idea. You have now taken on responsibility that you shall have a responsibility to protect the, I'm guessing, hundreds of thousands of good people that you have in Durham County. I should have looked that up, but I don't know what population is, but you shall do that. That's your responsibility. You accepted it, and we thanked you up front for doing that, and I will thank you again because not everybody is willing to take that kind of responsibility. Next slide. Next slide. Let keep moving because this is where I believe. Okay, let's stop right here. You can, and sometimes counties have passed you have a rulemaking authority. The best example I can give you of that, because we have a plethora of laws, rules, and regulations from state and federal government. But the best example I can use of an effective use of your rulemaking authority, and some of you may have been around when this happened, we used to have a fairly archaic rule and law for rabies control. I'm an animal lover. You might have heard my dog barking. I'm an animal lover. It did not give me any pleasure to have a quarantined animal and or a euthanized animal because of the old rabies rules. Well, the veterinary compendium, I'm told that's the ruling body of veterinary medicine, through science, epidemiology, realized that in North Carolina, in this nation, we were going a little bit overboard with our enforcement of rabies. So they said, you can get by with just a booster shot or initial vaccination for rabies after a dog bite and watch the animal. So it was so much better, so much easier on the health director and health department, and so much easier on the pet owners. The legislative body here in North Carolina had a busy year and could not get to changing the rabies law in North Carolina. So most, if not all, local health department boards passed a local rule which was more in keeping with the current science and made it a lot better rabies programming in North Carolina. So we passed local rules. That was very effective, very efficient, and was a success story. The next legislative session, when they had more time, North Carolina legislators were able to pass a law that was more in keeping with the current science. And in fact, now we have a state law. So then most boards went back and rescinded that rule that they made. So that's a good example of rulemaking, an effective and successful rulemaking initiative. Next slide. Let's move to the next. I think we beat that. All right. So you want to pass a rule. There's some things that you can do. And the example that I like to use is in Dare County, our coastal county. They had a lot of itinerant merchants that were selling seafood, shrimp, and fish on the side of the road. Well, they decided that perhaps a local rule was in order to address that problem. So what could they do in that instance? Well, they could prohibit somebody from doing something. They could say, good citizen, you can't sell shrimp on the side of the road out of an igloo cooler. Or they could say, yeah, you can sell shrimp out of an igloo cooler, but we're going to require you to be subjected to periodic inspections. And part of that inspection will mean that you keep the seafood at a certain temperature. And then if you don't do that, then they could assess penalties. So you can say, you can prohibit somebody from doing something, you can require them to do something, and you can set penalties. Let's move to the next slide. This is kind of outdated slide too. I don't think anybody really has many local drinking water rules or septic tank or on-site water rules. There might be a few mosquito control laws, rules out there in some of your coastal counties. But these are just examples. Next slide. What you can and can't do. You can pass a rule. You cannot have it be less stringent. Say, for instance, you want to do, the state says you have to have a septic tank 10 foot from the property line. Durham County's got a squeeze on available property for development. So they say, oh no, well, we're going to change that to 5 feet. Can't do that. Now, you can be more stringent if you wanted to spread out development more and say, well, the state says 10 foot from the property line, but you want it to be 20 foot. You can do that. You can be more stringent, but you cannot be less stringent. Next slide. Obviously, the rules must be related to health. Now, I don't know that this has ever happened, but would it be that a board of commissioners wanted to use you as cover, political cover, to pass a law, rule, or regulation that's unpopular? You can't do that. It's got to be reasonable, and it must be related to health if you pass a rule. Next slide. Certain things are protected. Restaurants have always been protected. They've got a very effective lobby and a restaurant association that's very large. So you can't adopt rules related to grading or anything else that involves restaurant openings, restaurant closings, and restaurant inspections and permitting. If you want to get into the smoking rules, it's a little bit murky because of case law that's been adopted. So if you were, and it's not, now we've got pretty effective laws, rules, and regulations on smoking and prohibitions on smoking. But if you wanted to go further than what you see and be more stringent, you would need to talk with the Institute of Government and make sure that you could, do what it is you think you want to do. Next slide. Oh, by the way, the Institute of Government is a wonderful resource for county commissioners and boards of health. And if Director Jenkins in his career hasn't used them, he will. So keep that in mind. The University of North Carolina is not an endorsement of UNC, but they have a very, very good Institute of Government there that help us in public health law, and they have a person assigned to public health law. All right, you can make a rule, but if you do, you're the adjudicatory board. So in my example I used, if somebody says, well, I don't want to be subjected to routine inspections for my seafood, he would come to you and you would be the adjudicatory board. And then after that, if he's not satisfied, then he can go to the district courts. Next slide. Let's go to the next slide. This is just telling you that when you sit at that board, you're a quasi-legal board, and that's a term that apparently is important to the legal community. Next slide. And next slide. So when we talk about you administering law, part of what you're required to do is to have a qualified health director. So even though you might not make a law, rule, or regulation, you still have legal responsibilities, and that is to hire a qualified health director. And believe me, yeah, it says you must consult with your county commissioners and state health director or designee. I know personally of a case where a health director was ineffective, let's to be polite about it, in one county, went to another county who was somewhat ineffective, and moved to South Carolina. And about 5 or 6 years later, he was hired back in North Carolina by a county. They ran it up the flagpole to the state, and they said, no, you cannot hire that person. We have history with him. So the state does get involved. Most of the time, 99% of the time, they're very happy with your hire. Keep in mind, someone else over your Board of Health has the authority to say who and what qualifications are required for your health director. Next slide. You can establish fees, and see, number one thing there says the commissioners must approve. So keep that in mind. If you wanted to start charging $10 for a blood pressure check, you would have to have that approved by the county commissioners. Or if you wanted to charge, $2,000 for a septic tank permit, which probably wouldn't happen, wouldn't be recommendable, but that has to be approved by your county commissioners. Next slide. Let's keep moving. We're getting kind of long in the tooth here. I think we have beat the legal responsibilities pretty good. I think you know a little bit enough about rulemaking that you could ask an educated question. And let's move on. Let's move on. We're going to skip the entire section 4. Go to section 5. This basically tries to go into telling you how to do what you do, and most of you are consummate professionals and know how to run meetings and do those kinds of things. That's the reason I skipped through that entire section. Just keep on moving. Get to section 5. Okay, let's go to the next slide. This is an important slide for me. I served on an elected board for many, many years, and it used to aggravate me when people came to the meeting and they hadn't read the materials. But as a board member, educate yourself. Be sure that you understand. If you don't understand what the health department is trying to accomplish, ask Director Jenkins. Be an advocate for him. Get the history. Know what the strategic plan. I don't expect you to, as a new board member, to read the strategic plan and understand it all, but get a good orientation from Director Jenkins so you know where the health department is headed and what it is they're trying to accomplish. Next slide. It's pretty easy. Let's move through that. I think these are just. Next slide. There's one slide. This is the one I wanted to get to, and which is probably surprising. Think, what's he going? Where is he going here? This is where I thank you one more time for what it is you do for your community. And the reason I like this slide, and although I know the Olympics has 5 rings, this reminds me of the Olympics. In my opinion, you people that have decided that you will spend your time, your energy, and your expertise are the best of the best in your community. You are, in my words, the Olympians of Durham County, because you have taken on this task with all the personnel, all the press, and all the political activities that surround anything in local government. You've taken on that task. You are the best of the best. You're the brightest and the best. And I'm not just telling you that. People, elected officials, and others have put you on this board because they think that of you. So thank you. I know this is the last slide that I'm going to use. I know that I might have went a little over. I'm not sure when I started, but I just want to end on a high note. You are the best of the best. You are the Olympians of Durham County. They appreciate it. I appreciate it because what you do, as I said earlier, is a representation of what people in North Carolina need to do because you guys are on the leading edge. Thank you. And I appreciate it. I'll take questions. Director Jenkins might be willing to take questions. And if you want to call him tomorrow and deep dive, I'm volunteering, Rod. You want to deep dive into something tomorrow, Rod? Have at it. Oh, by the way, you do get to evaluate me. So if you didn't like the presentation, then you're welcome to say that. If you did, you're welcome to say that. But anything in the university have an evaluation, and so y'all can do that. I believe you'll do that tonight, Rod, electronically.
Yes, we already have it.
Okay. So you can now tick off that box. You have now been trained as a Board of Health.
Yay. Well, thank you so much, Mr. Parks. That was really good. That was good. It was interesting and it held my attention. So it was very good.
Well, thank
Thank
you
you
for that.
Thank you. Any questions for Mr. Parks? Okay. So, Mr. Parks, this is a
No.
public meeting. You're welcome to stay, or if you
I think I'm gonna have dinner with my bride, but I will say that this is my first virtual presentation, and we made it through
yes,
with just a few technical glitches.
no, it was great. Thank you.
Thank you.
All right. All right. Good. So we are going to proceed with the agenda. So next will be the public health vacancy report. Any questions about that? I just had one little question, just a clarification, Mr. Jenkins, on the vacancy report for October. It said there were 43, but then when the calculations were done for the rate, the vacancy rate, it used 40. So was it 43 vacancies or 40? Now there were 40 in November, so I don't know if that was just a typo or something.
Could have very well been a typo, but I do know for the month of November, we did see an uptick in resignations, to be very straightforward. 1 week, I know we had probably about 4. That's the highest I've had since I've been public health director. So I'm leaning on the side of 43, but more than happy to clarify that and get that information back to you.
Okay. But that was the only thing I had on that. Any other questions or comments regarding the vacancy report? All right, the public health NOV report. Any questions or comments related to that? And then the health director's report. That 82-page report. Okay, very good. And I think, Mr. Jenkins, you told me this would have been the year for our reaccreditation, but it's been postponed, right? Because of
that is correct. So we're fortunate to have been we never stopped our activities. So we will take fiscal year 22 to really gear up, and we will have a site visit in 2023.
Okay. All right, great. Okay, committee reports. Nomination committee. And that committee consisted of Jim Miller, the chair, Spence Curtis, and who's the third person?
It's Gene. I'm the third person.
Gene, okay, I thought so.
Right.
I'm sorry.
So I guess I'll take it from here. The three of us, I guess, met virtually and talked about this past year, as well as what options we had for nominations. And we universally or unanimously decided to bring forth nominations to keep the current chair and current vice chair. So having Dr. Jackson and Dr. Braithwaite be the two nominations that we wanted to bring forward. With the nominating committee, correct me if I'm right or wrong on this, we bring the nominations to the board, and then the board will then, I guess, make a motion and vote on that. Is that correct?
That is
That's
correct.
So our job, the nominating committee's job's done at bringing those two nominations to the board.
Yes. Thank you
Okay.
for your service.
Thank you.
Thank you. Thank you. So Mary had to leave, but I do know that she agreed to stay on as vice chair. So I was excited about that. And she had to leave. So, but we do need to vote on the two nominees. And so I'll start with the vice chair position. So I'll need a motion from the
So moved.
floor.
So moved.
Okay, it's been moved. I'm not sure who said that, but it's been moved and looked like Spence seconded. I'm sorry, who was it?
Spence made the motion.
So I'll
Oh, you
second
made
the
the,
motion.
okay,
McDougal will second the motion.
okay. All right, so it's been moved and seconded that Mary Braithwaite remain vice chair of the Durham County Board of Health for this next year. Roz will do a roll call vote.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougal,
Yes.
Mr. Curtis,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam.
Yeah, I think she had to leave.
She's still there. You're muted,
Okay.
Commissioner.
Oh,
She may be stepped off.
she may have stepped
but-
away. Yeah,
Yes,
she might be
ma'am.
on the phone or something. Yeah.
Okay.
All right, great. So the motion carries. Mary will continue as our vice chair. So the chair position, we will need a nomination, a motion
Motion.
to have Dr. Rosemary Jackson continue as chair.
I move to have Dr. Rosemary Jackson continue as chair of the Durham County Board of Health.
I second that.
Okay, it's been moved and seconded. So we'll do a roll call vote.
Dr. Miller,
Yes.
Dr. McDougal,
Yes.
Mr. Curtis,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
and Commissioner Alam. Thank you.
All right, thank you. And thank you all again for that vote of confidence. I think we'll do great as long as we are all still together and work together. So I'm looking forward to the next year. All right, so I guess my first assignment is to appoint a finance committee and a personnel committee. So I am going to, actually, let me back up. The personnel committee wants to give a brief update report.
Since Mary's not here, I'll take that. The personnel committee is going to actually postpone the formal health director's review until next year. And this will be in accordance with the new county universal review process. We've already done an initial survey, but those results we'll still use those, so that effort won't be wasted. And we'll reopen the survey in maybe January to everyone, so everyone gets an opportunity to respond. And I can't remember exactly when the county universal review process, is it around April or May? Okay, so by doing this in January, that still gives us time to process the data and have it ready for either the February meeting or I guess at the latest, the April meeting. So that still gives us plenty of time and not have it and not put the cart before the horse and have to do the work twice. So by delaying it, it falls into the county's universal process. So that's the report for the committee.
Okay. All right, great. Thank you for that. Any questions for Dr. Miller? Okay, very good. So the Personnel Committee that I actually just appointed about a month or so ago. So I'm going to ask, and hopefully the current committee will agree to continue on the Personnel Committee. Now, Mary as Vice President is automatically the chair. And
So
the other person on Personnel is Dr. Orto. And I didn't really get a chance, and I actually saw her today, but I didn't think to ask her if she would be willing to continue, but I'm pretty sure that she would. So Jim, are you able and willing to?
Yes. Yeah, it makes sense to continue that way.
Okay,
Thank you.
Great. Thank you. So Finance Committee. So the Finance Committee really only meets once close to budget time, and it's to review the budget before it comes to the full board. Though the past year or two, we've actually just had one meeting one time to see it, but we still have to have a Finance Committee appointed. And the Vice President, again, is automatically chair of that committee. So I will need 2 volunteers to serve on the Finance Committee.
Rosemary, I'll volunteer to serve on it.
Okay, because you were in the nominating committee. Right.
Yeah.
Okay, and that's done. Okay, so that's fine. So
I think that commitment's met, so I can do the finance also.
okay. Okay, great. Dr. Ray and one other person.
I'll
I know, Josh, did you see me looking at you? Because you're actually, I can only see 5 of you all, and Josh is right in my eyesight because I was just about to call your name. All right, great, thank you. So Dr. Ray and Mr. Josh Brown will join Mary on the Finance Committee.
You want to know, it looks like my term does expire next month with the board. So assuming I am renewed for another term, more than happy to serve on the Finance Committee.
Okay, yes, I'm sure you will be. Did you by any chance receive an application?
I did reply.
Oh, okay, great.
That,
Yeah, I expire next month too, by the way, y'all. So hopefully I'll get renewed too. Okay, any old business? All right. Under new business, we have 3 budget amendments to ratify. Director Jenkins.
Yes, ma'am. Thank you very much. The first one, we just asked the board to recognize $150. Again, I say $150 from the North Carolina Department of Health and Human Services, Division of Public Health, CDI, and Cancer Prevention and Control Branch. The funds will be to be used for additional funding to increase screenings, diagnostics, and/or patient navigation services to eligible women in the North Carolina BSEP program.
Okay, you said $150?
Yes, ma'am.
Okay.
Exactly. The second, and I imagine that we can just kind of go through all of them.
Do all 3, yeah.
The second is to ask the board to recognize $10,000 from the North Carolina Department of Health and Human Services for community linkages to care for overdose prevention and response program implementation in public health. This goes toward our efforts with opioid reductions and all of our efforts around our Durham Tri program. And again, initially we received, initially received $100,000 for fiscal year 2022, but these are additional funds that the state is wanting to allocate to us. And the one that we added to the agenda was for the board to consider recognizing $514,327 from the North Carolina Department of Health and Human Services Division of Public Health Women and Children's Health Section Immunization Branch. These funds are to assist us with our continued COVID-19 response to help support activities associated with COVID-19 mass vaccination planning and implementation. Particularly, these funds are to help us with pediatric vaccinations and also boosters. That concludes the three that I have, Madam Chair.
Okay, all right, great. Any questions or comments from Mr. Jenkins regarding those three amendments to the budget?
Do we need to approve those?
Yes,
in
and I
motion?
think we can approve all three at the same time. So I'll need a motion for us to approve the three budget amendments presented by our director. All the funds are coming from the Department of Health and Human Services for existing programs to enhance three existing programs.
Motion to approve budget amendments?
Need a
Seconded.
second? Okay, thanks. It's been moved and seconded. So Roz, we need a roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Dr. McDougall. You're on mute.
Yes.
Thank you.
Yes.
Mr. Curtis,
Yes.
Dr. Ray,
Yes.
Mr. Brown.
Yes.
Thank you.
Okay, motion passes. All right, so next, I wanted us to discuss a little bit our meeting schedule for this coming year. So we've been doing every other month virtually now for almost 2 years. Like I've never met Josh. So, and things are looking pretty good. Omicron raised its ugly head. So but I want us to at least discuss whether or not we want to at least go back to our monthly meetings. All right, so that we are meeting a little more often so that, I guess, especially in this COVID space too, that we get the information. Rod is great though about sending out those weekly updates, or at least a couple times a month updates. So that's great. But I think it's probably time for us to go back to our monthly meetings. So we can have some discussion around that.
I think that's a good comment.
Okay, so if nobody is opposed, I don't think we have to vote on it or anything, but and I guess we can decide. I'm thinking actually to start in February. Keep our upcoming, let them sort of get jump started in January to see where Omicron is and all that, but plan to start February with our monthly meetings. And then if you want, we can discuss now whether or not we want to try to do some in-person meetings, but I'm thinking we can hold off on that discussion until February about actually getting back in person. But at least go back to our monthly schedule, the second Thursday.
Madam Chair, and on behalf of the staff, I just want to again thank the board for your patience and your benevolence in meeting every other month. It has allowed us to really focus on our pandemic efforts, and of course, you would imagine a lot does go into producing reports and making sure that everything is succinct with the board. But we thank you. We sincerely thank you for allowing us to go through a year without meeting every month.
Yeah. Well, no, thanks to the staff, and we're certainly in tune to that. And so, once we start in February, depending on how things go, perhaps if we need to back off again and do every other for a little while longer, we'll do that. But in February, we'll see how it goes. I am certainly hoping by this spring, things will be better. What do you think, Director?
We would have to see about Omicron. And
I know, yeah.
I think with all the antivirals and the most recent news from the FDA today, raising, the age for vaccinations and boosters, I think we should be all right.
Yeah, let's hope so. Let's hope so. All right, great. Thank you. And so agenda items for the next meeting.
Omicron.
Yeah, I was about to say that just an update, just a COVID update, particularly related to Omicron and how we stand in the county. And just that, I don't think there's unless there's some burning other topic anybody wants to hear about next in February. We'll stick with that. All right, very good. Thank you all so much for everything. Actually, I wanted to see, I'm not good at this.
Battery 90%.
But I want to thank you all
Connected to had to
for being such good people. Such hardworking, smart, dedicated, and just such good people. It's been a great year. I was being chair was a little nerve-wracking suddenly to become chair, but you all have been great, great, great to work with. So thank you so much. Thanks for all you do. And I want to say to the staff, the senior staff mostly that's on the call, you all are just the bomb. Just the bomb. I've been able to see you all work at some of the vaccine events. And again, it's just nothing short of amazing. And the way you're also able to continue to do all of the other things that's required of public health professionals. You didn't miss a beat. So thank you, thank you, thank you. And please relay to your staff that this board is proud to have you all working in Durham County Public Health, and keep up the good work. Thank you. Okay, now I'm gonna try something.
battery 90%. iPhone connected to Rosemary's iPad.
Was the night before Christmas, and all was stirring, not even a mouse.
In my mind. I'm gonna turn that down for a second. So folk who need to leave, please do. We need a motion to adjourn.
So moved.
And second. Okay, it's been moved and seconded. I guess we need to do a roll call vote, Roz.
Chair Jackson,
Yes.
Dr. Miller,
I think he's gone.
no, he's still there.
Oh,
Dr. McDougall,
Yes.
Yes.
Mr. Curtis,
yes, happy holidays.
you too. Dr. Ray,
Yes.
Mr. Brown,
Yes.
and that's gonna be it. Thank you, guys.
All right. Have
Happy
a
holidays,
safe,
everyone.
Safe, healthy, good time holiday. Look forward to seeing you in the new year.
Happy holidays.
Bye now.
Stay safe.